Good morning. My name is Victor Sande. I'm a counselor psychologist by profession, registered by the Kenya Counseling and Psychologist Board. I'm also a medical laboratory technologist registered by Chemist TB and a Billings Ovulation Method teacher registered and licensed by the WOMS International Australia. Welcome to my YouTube channel. For today's lesson, I will focus on the Billings Ovulation Method, a natural family planning method, and a knowledge that every woman needs to have. When we hear about natural family planning, people tend to be scared or to fear when they hear about natural family planning because out of experience, majority of people or majority of couples, some of them who have tried this method, they failed. And when they failed, they said natural family planning does not work. Let us see, is it true that natural family planning does not work? Or what kind of natural family planning are we talking here about? Because the method that today I want to talk, it is called the Billings Ovulation Method. This particular method, it is 99% effective once its rules and guidelines are adhered to. The Billings Ovulation Method, this method was first introduced in 1953 by Dr. Billings. In fact, the name Billings, it is a name that was given to this method to honor the founder who was Dr. Billings. And this method, it uses the natural science that a woman, the natural science of her body, that a woman can be able to observe and can be able to experience through her body. These are the signs that on daily basis a woman can be able to observe and utilize them as a couple, either to achieve or to postpone pregnancy. Now, when we hear about natural family planning, why are many people scared of it? Many people today are scared of natural family planning because when they hear, they always refer to the calendar method or to the withdrawal. And if you ask majority who have used this method, they will give you some of the techniques that they have been using. And I find that this was not the correct method that they were supposed to do. Actually, it was referred to be as natural because it didn't utilize any synthetic or barrier method. Uh, but let us see, why does calendar method uh, is not that effective when you are referring to natural family planning? Ideal, the natural family planning under the calendar method was the best and known method in old times. But today, that method is outdated. And in fact, Billings ovulation method came to replace it because of the failure of the high failure rate that the calendar method had. Because with the calendar method, it had a lot of disadvantage. And one of it was, if you have short cycle, you cannot be able to use it well. Because with the calendar method, you have to count days. Under the counting of days, you had the phases that you could abstain, and there are other days that you could use them. And they were using counting of days in order to be able to, some I can relate it to guess on the days that a woman is ovulating. Based on that, a woman could be able to calculate on these particular days. And you find that with the calendar method, again, if there's a change, there are factors that affected this method. Once there's a physical strenuous activity that could delay ovulation. Number two, illness could also delay ovulation, changing of weather, and also by nature, your reproductive system as a woman ages, and when it ages, it ends to borrow or to have different characteristics that you did not have. And remember, you are talking about under the Billings Ovulation Method, we are talking also about the cervical mucus. This cervical mucus is being produced by the cervix. That organ of your reproductive system is very important in you. And this organ, it ages. And once it ages, even with the characteristics of the mucus that produces, it keeps on changing. Now, if you have been depending on the calendar method, failing to keep in these factors, what happens to you? You might end up thinking yourself on the days that you think you're okay, and those days are not safe. And that's why today I want to introduce and to assist you to be able to understand what now I'm referring to the Billings Ovulation Method. That I say it is 99% effective. Scientifically, it has been approved, and many research have been done on this particular method by different professors and doctors, whom they have come into conclusion that this method, it is effectively in helping couples who wishes to use the natural way to plan their family as to be safe, reliable, and predictable. But what does this method for you, if you want to be successful in using the Billings Ovulation Method, first you have to be disciplined. And this is one of the value even as a couple you need to have. It also consists of cooperation. You need to work as a team, not as individual. Because if you work as individually, it will eventually fail because it requires the spouses, the couple to come together because there are some moments in this particular method that will be required to abstain, to respect the fertile phase. And this method does not use does not use barrier or any chemicals. It is purely natural. And there is no genital contact. And as we progress with this education, you'll be able to understand later on why it's important to do that. And we have seen many people who embrace this method. Actually, they're appreciating now that this method it is effective. What they thought earlier, they were misled. But after gaining the knowledge and practicing it with patience, they are now, in fact, advocating for it for many couples to be taught on this particular method. Uh, I feel it will be justice for me first to share with you the woman reproductive system. So, because there are some words that I will use as I understand my audience, there are some couples or individuals that biology, you didn't like biology in your secondary school, or in fact even you didn't do it biology. But actually what I'm providing for you to be the basic so that you can be able to understand and to visualize what I'm talking about. So you will hear me talking about cervix, you will hear me talking about hormones, you will hear me talking about endometrium, you will hear me talking about the fallopian tubes and the ovary. When I'll be talking about this, if you haven't maybe visualized them or you haven't been taught about this, it might be seen difficult for you. And kindly also note, disclaimer that I'm putting here, whatever I'm teaching here, it's for awareness purposes, not for practicing. If you want to practice, kindly contact a teacher certified by the WOMS International or any other local teachers who have been trained and certified based on their bodies that have certified them in the country. But for me, Victor, I am certified by the WOMS International Australia. Feel free to contact me when you feel you need to use this method. Kindly do not practice on your own because this is one of the issues that we have encountered or I have encountered as a teacher. I give a talk, somebody picks what I'm saying, somebody picks whatever I'm saying here, going to practice without having been guided. This method, it is simple, it is easy, but also not easy. It is not difficult nor easy. It is not difficult once you have been trained and guided by a qualified teacher who will work with you. But it is also difficult once you are not committed, you have not worked with a teacher, because a time will come whereby you will need guidance, you need to be corrected, you will need to be helped in terms of interpretation of the charts that will be charting on daily basis. Sawa. Let me now go and share with you something here. Now, like I've told you, I am a W.O.M.S international teacher, certified by the W.O.M.S, and whatever the materials here I'm using, they are from the W.O.M.S International. Now, when we talk about the Billings Ovulation Method, look at how those ladies are smiling. They understand they are free from any worry. They understand their bodies, how it operates. Huh? I wish it could be you. But you might be surprising, why are only ladies here? For the purpose also of this Billings Ovulation Method, it is not only for the couples. It can also be used by women who wants to understand how their body naturally operates. Because by knowing that, they can be able to detect at an early stage if there is any abnormality. And this brings us to another function of the Billings Ovulation Method, that it can help women to monitor their reproductive system. This is a knowledge that every woman ought to have. It uses the natural signals of fertility, and the couple can either use it either to achieve or to postpone pregnancy and monitor their reproductive health. We understand today we have a lot of problems regarding the reproductive system, a lot of diseases such as cervical cancer, ovarian cyst, even ovarian cancer. These diseases, you find that there are signs that normally they emanate even before it progresses further. And which are these signs? If couples wish to understand themselves with the Billings Ovulation Method, it will equip you with the knowledge to be able to understand when there's a problem with their reproductive system, because the mucus that I'll be talking about, the cervical mucus that woman you produces, they will infer to you what's happening under your cervix, what is happening in your ovaries, in your endometrium. All these, they'll be able to be reflected by what is coming or emanating from your vagina. Like I've told you earlier, it will be justice for me first to take you through the female reproductive system so that you can be able to understand and to visualize whatever I'll be talking about. Now, this is the female reproductive system. As you can see the cervix. Here is the cervix. This is the organ whereby the mucus that I've been mentioning now and then, they are being produced here. Let me look for a pointer. You can use the pointer. The cervix here is whereby the mucus that a woman, the mucus emanates from this organ. They are being produced in this organ called the cervix. The neck of the uterus, This organ is very important in your reproductive system. Without it, you will not be able to produce mucus. And even without mucus, you cannot get pregnancy. Once it produces the mucus here, the mucus will be able to flow along the vagina when you are in upright position, and you can be able to feel it, this mucus, under in this place also we call the vulva. And this vulva, which is the mouth of the vagina, it is very sensitive. Its sensitivity is 5 times more than that of a fingertip. Look at this fingertip when you just touch it, how sensitive it is. And you are being told the vulva is 5 times sensitive than the tip of a fingertip. Then we have pocket of Shaw. Pocket of Shaw in the Billings Ovulation Method, it plays a greater role in helping you recognize if peak has occurred. You might also, I'm confusing you more when I call, when I mention that term peak. You might have, what is this peak I'm talking about? Don't worry, stay tuned. Once, as we progress, also you'll be able to understand peak. What is peak? Then we have ovary. This is where the eggs are being produced. The eggs are being produced. And when these eggs are being produced, we have many eggs. But remember, once in a cycle, only one egg or two in case of twins or three in case of triplets, these eggs here, they will start the process of maturity. They will start the process of maturity. Once they start that process, what happens? They will start to produce estrogen under the influence of uh, other hormones from the brain. They will start the journey. Once they start the journey, they will produce those hormones. One of the hormones is called estrogen, and estrogen will have an effect in this region called the cervix. It will stimulate the cervix to start producing mucus. Remember, we say in this, it is in the cervix that the mucus is being produced, but it will not be produced unless it has been activated by the hormones. And these are the hormones that will be produced here. They will be the mucus that will be produced here. They will have been activated by the hormones produced by the eggs as they mature. And remember, these hormones, they are being produced gradually and increase in quantity as the egg matures until the time that the egg will have matured and released through the process we call ovulation. Then we have the fallopian tube. This is the tube. Once the egg has been released, it will travel along this tube here. It is in this tube that fertilization occurs, where the egg and the sperm meet. And once fertilization occurs, it will come to attach itself here. In this region, we refer to as endometrium. As for me, I always refer to it as the bed of the baby, where the baby can be able to be attached. Having summarized for you that, you can also go for the notes here. The cervix, it acts like a biological valve. It opens during menstruation, allowing for menstruation flow. Where does the menstruations come from? It is under this wall we call endometrium. Remember also the hormones, once they are being produced here, they also have an effect here. These hormones are estrogen and progesterone. They are being produced in different phases. They make this wall, endometrium, to proliferate. It will keep on building. But once in place, this particular wall will fall and referred to as menstruation flow. Being told in this particular phase, the cervix will open to allow the flow of the blood. We refer to as menstruation flow. It is closed with thick, dense mucus during the infertile phase, making it impossible for sperm uterus. I will also explain the importance of the cervical mucus and different types of mucus in the Billings method, that it assists the couple in order to identify the fertile and infertile phase. Now, it forms a plug here. That sperm cannot be able to penetrate. Remember, the uterus is sterile. There is no any bacteria here. Uh, it opens during the fertile phase, producing mucus with physical and chemical properties which enable it to protect and to nourish sperm cells and to guide them from the vagina up to the fallopian tube. With that summarization of the female reproductive system, when I'll be mentioning these terms of the reproductive system, you can be able to visualize them well. Let us take at least 1 minute. Just look at that diagram. Look at where ovary is. The ovary is found. Look at the fallopian tube, the tube along, whereby once the egg is released along. Also, I'll be able next to give a video animation of how the on how the reproductive system works, the ovulation, the whole cycle, and the phases. You'll be able to sit and to visualize it. But that one is for another session. And you can see here the endometrium, where the baby will, if fertilization occurs. But if fertilization occurs, this wall will have been built and it will eventually fall because of the cascade of the events that will be taking place in the reproductive system. And here the cervix, which we have been told it acts like a biological valve where it is closed and open, depending on the different phases. Vagina, the hollow part, where this is where the penis enters and it cannot be able to reach here the cervix. It's an important organ where also sperms are being deposited here of show where it absorbs moisture. This is the time that a woman feels dry. And when you feel dryness, especially after ovulation, this region we call pocket of show, under the influence of it absorbs any moisture so that a woman feels dry during that particular phase. Now, having seen that, I hope you will now appreciate whenever I'll be mentioning about those names. Now, let us go back. Now, this method of natural family planning provides a woman with simple markers of her fertility, signals that she can be able to recognize. Look at that t-shirt, the label, my body, my standards. She's able to she understands herself, how her body operates. She is free from many worries about her reproductive system. Which are these natural signals that you are talking about? It is the mucus. Mucus. Many women, from my little research that I've done, from my clients who have been taking them through this method, some they were not able to understand, or they didn't know the importance that the cervical mucus it plays in their reproductive system. Some of them they thought it was infection, it was something that they needed to do away with it. Some even they did everything possible to ensure that they do not have, when they see, maybe even they use Dettol soaps to clear the mucus. Some they use even Dosh. Huh? But today I want to tell you that cervical mucus is a sign of good health. Remember, if you do not produce cervical mucus, you cannot be able to conceive. Why? Let us see ahead what happens. This method is based on the knowledge that the woman's cervix responds to the changing hormone levels throughout her menstruation cycle by producing different sorts of mucus. The mucus that a woman produces is not constant, is not the same, is different based on the phases that a woman is in. Remember the cycle, the menstruation cycle, it has 4 phases for women with long cycle above 27 days. And these phases are menstruation, infertile phase, which is not absolute, then the fertile phase, then the absolute infertile phase. But we will tackle them deeper under the menstruation cycle phase. These mucus, you have been told they are different. Consistency is not the same depending on the phases that a woman is in during her cycle. We have 2 types of mucus, the fertile and infertile mucus. What are the importance of this mucus in a woman's reproductive system and generally in her body? First, how long do you think can sperm be able to survive? Couples have been giving me, or individual women have been giving me this answer: 3 days, 72 hours. But today I want to tell you, cervical mucus, no, sperm can be able to survive in fertile mucus for 3 to 5 days. Mark that. Sperm can be able to survive in fertile mucus for 3 to 5 days in fertile mucus. But sperms cannot be able to survive for long. In fact, it dies within a short period of time in infertile mucus. It dies. What then are the properties of these 2 types of mucus that we are talking about? With the fertile mucus, one of the properties, it nourishes the sperm so that sperm can be able to live for long, waiting for ovulation to occur. If ovulation has not occurred, or if ovulation is expected in the next few days, so that sperm can be deposited there, it will be nourished, waiting for the right time to travel along the fallopian tube. And that one also, I have also mentioned the second function of this fertile mucus. It provides a road network for sperm to be able to travel along the fallopian tube. With this structure, even in the laboratory, with this mucus, it has been observed and documented. And one of the professors that did this work was known as Professor Odebladi, who visualized and did the research in the laboratory and found that these different types of mucus, under their subtypes also, they have different characteristics. And one of them, when I'm talking about the fertile mucus, it provides road network for sperm to be able to survive. The other function, it locks the abnormal sperms, not allowing any sperm with a defect to pass through. Can you imagine if this property was not there? And a man in every ejaculation releases millions of sperms. You wonder, where will they go? Now, with these characteristics, one of these, it also helps in eliminating and allowing only those with good quality they can pass through. Then, what about the infertile mucus? Sperm cannot be able to survive for long. It is the opposite of what I've mentioned about the fertile mucus, because sperms will die within a short period of time, because with that environment, infertile mucus, it creates an conducive environment for sperm to be able to survive. It is acidity environment whereby sperm cannot be able to thrive for long. And this is one of the properties also. It helps the couples who wish to postpone pregnancy. They will have that particular knowledge of being free from worries, that when they have sex during this phase, now guided by the rules, which also I'll also be able to provide a lesson on this in the next upcoming session, to see and to appreciate this. Now, this cervical mucus is essential for sperm survival. Without it, it is impossible to conceive. This cervical mucus is essential for sperm survival. Without it, it is impossible to conceive. We have today many couples, some who are labeled as barren, and they were not labeled, they were not barren, they were only subfertile. But they didn't know, because they didn't have this knowledge. Maybe they were just releasing this mucus within a short period of time and it disappears. Because they didn't have this knowledge, they could not get pregnant. Maybe the husband is far, maybe the timings that they were different. But once you are being taught also with this method, it can assist. But we have also women who they totally don't produce this. Without this, sperm cannot be fed, it cannot be transported. And once you see we don't have this, what happens? You can't conceive. Now, a woman, how long or how many days is a woman fertile in that whole cycle? Generally, a woman is fertile for 5 to 8 days in a cycle. 5 to 8 days in a cycle. That whole cycle you're talking about, from the first day that she bleeds until the next menses begins, that is the cycle, is only fertile for 5 to 8 days. Why is it important even to understand this concept? We said sperm can be able to survive 3 to 5 days in fertile mucus. And here again, I'm saying a woman is fertile. That is the fertile phase for 5 to 8 days. How is it connected with the survival rate of the sperm? It's because if a woman is fertile for 5 days, what does it tell you? And here you are talking about the fertile mucus. Is this fertile mucus can live for 5 to 8 days. That means, let me use this example. If today a woman begins the fertile phase today, and she expects, but this one I'm using it is for the purposes of using an example, but in this method, we do not predict. It is on daily basis. Today, a woman, she begins her fertile phase at a point of change. She has been having infertile phase, then the beginning of fertile phase, day 1. She expect maybe the next ovulation will occur in the next 5 days. If today they have sex, or she had sex, that sperm that have been those sperms that have been deposited there can be able to wait until the time that egg will be released. It will be fertile. It will be fertilization will occur because these sperms will be there waiting. We said the cervical, the fertile mucus, it nourishes the sperm. They will be fed, waiting for ovulation to occur. Even if this couple, they postpone and abstain from sexual intercourse, expecting that nothing will happen. But because of the survival and the properties that this cervical mucus have, the woman might end up getting pregnant. And that's why we are saying there are rules to be applied and to be adhered if you wish to postpone pregnancy. And this method, it will empower you to recognize this phase of infertile phase and fertile. The infertile and fertile phase. And these rules are very simple. I might speak to you, you might see it's a complex process, but this is the good news. This method, even an illiterate person can be taught. The 8 days, that why it extends to 8 days, you will appreciate it later on. Now, this method teaches a woman to recognize her body's natural sign of fertility and help her identify the fertile and infertile times in a cycle. Look at how she smiles. She knows herself. She knows when she's fertile or not. And remember, I can also give an example and I equate it with our weather. How do we know when rain is coming? We have signs, the weather forecast. What do they use? They read signs and they interpret. With these signs that we are seeing them, rain is about to come and they prepare themselves. For farmers, they can utilize that particular knowledge to start tilling their land, expecting for the rain to come as soon as possible. It is the same even with the human body. God designed your body in a special way, and He instituted these seasons in you. It's upon you to take time to understand about your body. It takes a lot of time and energy to study about different concepts in the world about our education. But we do not have time for our bodies. And what is more important, if not your body, the health of your body? Remember, we struggle and we sweat every day to look for money. We do not have time for our body. We have a lot of burnout day and night, seeking for money, but that money we are looking for, failing maybe to recognize even our own health. We shall use the same money to look for the health that we have been ignoring. We need rest, and that rest we can take it even in knowing ourselves. Let us invest in our bodies, please. And one of it is through the Billings Ovulation Method that you can invest as a couple, as a woman, to understand your body, to appreciate how God created you, and to utilize it. There is no need of stressing yourself too much when there is also a method. Remember, some of people have been using contraceptives, and maybe because of one reason or the other, they've been told you cannot because of religious, like I am a Catholic, I am supposed to use the natural. I understand it. And remember, even the Billings Ovulation Method is not afflicted to any religion. It is purely science. But it is other religions upon them to appreciate it and to utilize it if they wish. And anybody can use. Look at how she smiles. How I wish even you maybe you are suffering in one way. You have difficulty in conceiving. This is a method can assist you in identifying problems or in helping you to know when you are fertile or not. Remember, some even couples, they have been fertile, but because they didn't have this knowledge, they were ovulating even during or after periods, but they were not aware of this. Based on the African culture, it is a taboo to have sex during period. And also, as a teacher, I've used this technique to help them. Some women, couple, they had problems with conception, but later on, when I introduced to them about this method, they appreciated, they used it, and eventually God blessed them with a child. This method is also help the couples to be in control, regardless of whether they want to postpone or to achieve pregnancy. Under this, I do not use, I avoid the word avoid, because pregnancy is not a disease to be feared, but it's something that we need to appreciate it, because it is through the sexual act that human being we come into being. And when we fear today pregnancy like diseases, that it has to be avoided by all means, then we forget even the purpose, the primary purpose of sex. That is for procreation. And that is the only means that we cooperate with God to bring life into our human nature, into our Mother Earth. That is the best. We cooperate. Remember, how do you feel when you understand that I cooperate with the Lord through the sexual act that we partake with your husband, with your wife, then God infuses the soul. How beautiful it is. But also, this doesn't mean that I'm saying that we need to have babies as many as baby. Be responsible under the responsible parenthood. How many child do you need? Can you be able to afford and to cater? You can be able to provide for their food, their health, and their spiritual needs. Also to consider that. And which is the best way? Here we have the Billings Ovulation Method. Field trials have shown that greater than 99% effectiveness when used in accordance with the four simple rules. This Billings method, it uses four rules. I can mention them, but later on we'll see them into depth. Number one, no sexual intercourse during heavy bleeding. Number two, and their why we shall see. Number two, sexual intercourse in confined on alternative evenings on the days that have been identified as BIP. Number three, it says if there is a change from the infertility phase, you abstain and wait and see what happens next. If BIP, the infertile phase, return, you count day 1, day 2, day 3, then you resume sex on the fourth day if these days have been BIP. Rule number 4, which is now the first three rules, we call them the early day rules. The fourth rule is called the peak rule. Once peak has been identified, you count day 1 after peak, day 2, day 3. Then the sexual intercourse will be available from the fourth day until the next menses without rules being applied now. Sex is available anytime, any day. Those are the simple rules. But the way I've mentioned them, you might see them difficult, but they are not difficult. I will synthesize them or simplify them so that you can be able to understand. They are simple. But how will they be simple if you don't want even to attempt? Try it and see. And you can see, I've told you, this scientifically researched, empirical research has been done. And where was this research done? In India and even in China in 1995 and in 1997. But research, remember, they were done previously. These were ongoing research to continue to improve it more. But so far, the rules have been intact and certified even up to today to be 99% effectiveness once used. Also, under achievement of pregnancy, the most recent study revealed 73% pregnancy rate for all couples wishing to conceive by using this particular method. You see, no stress, it helps you, it equips you with the knowledge. Eh? And then the 53% pregnancy rate for couples who had previously tried unsuccessful for a year or more. Even those who have tried IVF, uh, the intrauterine or mambo whereby couples who have been finding difficult sometimes, they're being told they can be done IVF in order to assist them to carry pregnancy. But with this method, we are being told 53% pregnancy rate for couples who had been previously tried unsuccessful. We find many couples are struggling. They have gone to gynecology, they have visited gynecological clinics, tests have been done upon them, but everything is okay. But they wonder why they are not why the woman is not conceiving. And you find that, like I've been mentioning, some of these problems, because maybe they don't know their bodies properly. Some of them, they have been just subfertile. And you can see, imagine out of 20 to say, let us say, they have been finding it difficult to conceive. But when they use this method, maybe 10 out of 12, they successfully conceive. You see, that rate will have reduced this issue and the problems that women suffer through. Even the couples, they suffer through psychologically, emotional, spiritually. But also you have to understand their couples also, they have problem. They are truly barren and proven. The other element is monitoring of their reproductive health. Look at those ladies, how they smile. This third function, it is what pushes us also to ensure that this knowledge is not only available to the couples, but also to the young ladies. It's important for them to be able to understand and to have this knowledge. Why? Remember, even for them, they experience this menses. They have that cycle in them. They every cycle, they menstruate. But they need to understand, are they ovulating? Remember, every bleeding that you see is not menstruation. It is not menstruation. Menstruation for real, for the bleeding to be qualified as menstruation, peak has to be recognized. Failure to that bleeding is not menstruation. And this knowledge will help the couple, even this young lad, to understand their bodies. Remember, when first time that they experience menstruation, they are confused. They don't know what is happening to their bodies. And by the time that their cycle stabilize, it takes some years. Some they have irregular cycle, which they do not understand. They have painful menses, they have cramps, they don't understand their bodies. How will they be able to understand if we do and share with them this knowledge? And even this can assist them to detect if there's problems with their cycle. Remember, if they are treated at an early stage, we can be able to correct the reproductive issues at an early stage by taking maybe medication, or some of them, they can even go surgery. Some of them issues. Now, how will they know if they do not know how their body operates, so that they can be able to filter and to recognize this is abnormal and this is abnormal? It's not only about that whenever we teach them, it's no. This is an aspect that we also teach them to understand their bodies, how it operates, and to recognize how beautiful it is. Look at how they smile. If you understand, my body is okay. If I had problem, these are the signs that I can be able to say, to be able to see. Now, ovulation is a sign of good health. And when I mention ovulation, what comes to your mind? What is ovulation? It is the release of the egg. Remember, in the ovary, you have many eggs, immature eggs, what we normally for follicles. Eh? These eggs, they want to be released every cycle. But sometimes that is not what it happens. They can be laid because of several factors. Some, they can be severe and they can cause havoc in your health. So if you do not ovulate, then you understand there's something wrong. Or based on the knowledge that you have been equipped, you understand that ovulation can be delayed by several factors. We have lactating mothers, breastfeeding mothers. Ovulation can be delayed. Changing of weather. The beginning of menses. When you have the first time that a lady experienced menses, ovulation might be delayed. Perimenopause, those who are approaching menopause, ovulation can also be delayed. But how will you be able to understand and to know that it is because of perimenopause? It is through charting and revelation of the pattern that your body will be able to reveal to you, that you can be able to understand. Under this circumstance, you say, oh, I understand myself. But if there's any drift from the abnormality and you have ruled out these other things that I've just mentioned them, you can be able to understand. No, I have an issue. It might be ovarian cancer, ovarian cysts, because each time the egg is being released, it is undergoing that process of maturity. It releases this hormones gradually. This oxygen, they have effect on the endometrium and the cervix, and you can be able to see it through the mucus that you produce. Now, the mucus, they infer to you what is happening in your body. If it's of good quality, you'll be able to understand things are okay. And if it doesn't happen, what happens? Then there's a problem. And you can see the reference under Professor Pilar Vigil, Biomedical Division, Reproductive Health Research Institute. This method provides an invaluable guide to the woman's reproductive health. She will be alerted to any problems at an early stage. It is safe. This method, it is safe because it doesn't interfere with your normal biological process undergoing in your body. It is reliable, it is 99% effectiveness because there are rules to guide you and to ensure you do not drift away. And it is simple to use because it uses your natural indicators of fertility. It has no side effect as the woman's natural body process are not disturbed. I hope you have gotten something from there. Now, the next video or virtual class that I will give, it will be how can a woman be able to tell when she's fertile or not fertile? When a cervix is open or not? How to make observation? How to make observation? This one, I will be able to do it for you and to help you next session. Kindly, if you have learned something, make a like. Kindly just click on that like, subscribe to my YouTube channel, continue to spread this gospel of the Billings Ovulation Method so that it will reach to many women, to many families, and so that many women and couples, they can be able to empower. This is a method that every couple ought to have. You have been hearing or you have been listening to Victor Sunday. I am a counselor psychologist, medical lab, and a Billings Ovulation Method. It is my passion to empower humanity. With that knowledge, kindly do justice for me and for many couples and women by subscribing and spreading this gospel more. Bye bye. Let us meet next Sunday or Monday for the phases of the cycle. Welcome.